Hello friends, so today we are going to talk about attention deficit hyperactivity disorder, which is also called as ADHD. It's a neurodevelopmental disorder that affects both children and adults, right? It is characterized by persistent patterns of inattention, hyperactivity and impulsivity that can interfere with daily functioning and development, right? ADHD is a complex condition and its exact causes are not fully understood. However, a combination of genetic, neurological, environmental and prenatal factors is believed to contribute to its development, right? So let's discuss the common symptoms of ADHD. The first one is inattention, right? So here the person feels difficulty sustaining attention in task or play activities. There could be frequent careless mistakes in schoolwork or other activities. There can also be, let's say, forgetfulness in daily activities. That is also seen, right? There could also be difficulty organizing tasks and activities, right? That also happens. There's avoidance of tasks which require sustained mental support, right? So let's discuss the second aspect, which is hyperactivity, right? Here there is fidgeting or tapping hands or feet. We can see inability to stay seated in situations where it's expected. There could also be running or climbing in inappropriate situations. That also happens, right? There's difficulty engaging in activities quietly. That is also observed, right? There's a lot of excessive talking and things like that, right? Now let's move to the third aspect, which is impulsivity, right? Here there is impatience, difficulty waiting for one's turn, or interrupting or intruding on others' conversations or games. That happens, right? There's difficulty inhibiting inappropriate comments or actions. That is also seen. Now let's move to the subtypes of ADHD, right? So it is basically on the basis of predominant symptoms only the subtypes have been classified, right? So the first one is predominantly inattentive presentation, which is also called as ADHD-I, right? It is hard for the individuals to organize or finish a task or to pay attention to details or to follow instructions or conversations, right? The person is easily distracted or forgets details of daily routines. That is seen, right? So individuals with this subtype often have difficulty sustaining attention, being organized. They may appear forgetful, easily distracted, and may frequently switch from one unfinished activity to other, right? So that's also seen. Hyperactivity and impulsivity may be less pronounced compared to the other subtypes, right? So that also happens. Now let's move to the second one, which is predominantly hyperactive impulsive presentation, which is ADHD-H, right? So the person fidgets and talks a lot, right? It is hard to sit still for long, example for a meal or while doing some homework, right? So smaller children may run, jump or climb constantly, right? So that's seen. The individual feels very restless and has trouble with impulsivity, right? Someone who is impulsive may interrupt others a lot, grab things from people or speak at inappropriate times, right? It is hard for the person to wait their turn or listen to directions, right? A person with impulsiveness may have more accidents and injuries than others, right? People with this subtype displays hyperactivity and impulsivity without significant inattention, right? So that's also seen, right, guys? So now they may struggle with sitting still, talk excessively, and act without thinking about the consequences, right? So that's also seen, guys. Let's move to the third one, which is combined presentation, which is ADHD-C, right? This is the most common subtype involving a combination of both inattention and hyperactivity impulsivity symptoms, right? So here what happens is that ADHD can have a significant impact on various aspects of life, including academic and occupational performances, right? So that happens even on relationships, even on your self-esteem, right? So that's seen. Now diagnosis typically involves a comprehensive assessment which includes, let's say, clinical interviews, observation and there could be like standardized rating scales as well, right? So it's important to rule out other medical or psychological conditions, let's say, that may mimic ADHD symptoms. So that's very important, guys. So let's just discuss the risk factors of ADHD, right? So researchers are not sure what causes ADHD, although many studies suggest that genes play a large role, right? Like many other disorders, ADHD probably results from a combination of factors, right? In addition to genetics, researchers are looking at possible environmental factors that might raise the risks of developing ADHD, and are studying how, let's say, brain injuries, nutrition, and social environments play a role, or let's say they might play a role in ADHD, right? So that's there. So ADHD is more common in males than females, right? And females with ADHD are more likely to primarily have inattention symptoms, right? People with ADHD often have other conditions such as learning disabilities, anxiety disorder, there could be conduct disorder, depression, and substance abuse disorder as well, right? So that's observed. Now let's move to the diagnosis part, right? So diagnosing ADHD usually involves a comprehensive evaluation by a healthcare professional, such as psychologists, psychiatrists, or even pediatrician as well, right? So the assessment often involves gathering information from several sources. So it could be your school, it could be from your caregivers and parents as well, right? So the ADHD diagnosis is based on criteria outlined in the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, which is also called a DSM-5, right? So note that, right? If for a person to receive a diagnosis of ADHD, the symptoms of inattention and, or let's say, hyperactivity, impulsivity must be chronic or long lasting, right? It should impair the person's functioning and cause the person to fall behind typical development for their age. Stress, sleep, anxiety, depression, and other physical conditions or illnesses can also cause similar symptoms to that of ADHD, right? So therefore, a thorough evaluation is necessary to determine the actual causes of the symptoms, right? So most children with ADHD receive a diagnosis during the elementary school years itself, right? For an adolescent or adult to receive a diagnosis of ADHD, the symptoms need to have been present before age 12. So that's important, right? Now, ADHD symptoms can appear as early as between the ages of 3 and 6 and can continue through adolescence and adulthood, right? So symptoms of ADHD can be mistaken for let's say emotional or disciplinary problems, or missed entirely in children who primarily have let's say symptoms of inattention, or which can lead to let's say delay in diagnosis as well, right? Adults with undiagnosed ADHD may have a history of poor academic performance, problems in work, or difficult or failed relationships as well, right? ADHD symptoms can change over time as a person ages. In young children with ADHD, hyperactivity, impulsivity is the most predominant symptom, right? As a child reaches elementary school, the symptom of inattention may become more prominent and cause the child to struggle academically as well, right? In adolescence, however, hyperactivity seems to lessen and symptoms may more likely include feelings of restlessness or fidgeting, but inattention and impulsivity may remain there, right? So that's there. Many adolescents with ADHD also struggle with relationships and antisocial behaviors, right? Inattention, restlessness, and impulsivity tend to persist into the adulthood as well. So that's also observed. Now let's move to the treatment part, right? So basically the treatment for ADHD can include medication, it can include psychotherapy, education or training, or let's say a combination of treatments as well, right? So for many people, a combination of behavioral therapy and medication can be really very effective. That's also seen, it can be effective, right? So it's important to note that while ADHD can't be cured, right, it can be successfully managed, and many people with ADHD symptoms can actually lead productive, fulfilling lives as well, right? So treatment plans are often tailored to the individual's unique circumstances. So that's possible, right? If you suspect that you or your child may have ADHD, it is crucial to seek a thorough evaluation and appropriate treatment from a qualified healthcare provider, right? So that's very important. Early diagnosis and treatment can make a significant difference in the outcome of the individual, right? So I hope you enjoyed this video on ADHD. Thank you so much for listening. More such videos are coming your way. Thank you so much, guys.